Hello, Diana.
Hello.
Thank you for joining me today for this episode of Thrive with Us. I'm
Thank
really
you.
excited to have a chat with you about something that I know you're very passionate about, which is women's issues and mental health.
Thank you for having me.
So, before we begin, I just want to quickly introduce you to our audience. I am sitting here today with Dr. Diana Cheaib Houry with a PhD in psychoanalysis from the University of Paris 7. Dr. Diana has been with us at Thrive since January 2022, and she incorporates psychodynamic psychotherapy in her work with adults. As I mentioned previously, one of her primary areas of interest is women's issues and mental health. Thank you and welcome again.
Thank you for having me again.
So please tell us a little bit about women's mental health and women's issues. This is a major area of interest. I know you do a lot of work with women in our community. How did this come about? How did this interest and passion develop?
Well, it has been always an interest of mine. Since my first research work, I had many questions regarding women and the complexity. We were speaking, I think, a few days back about how complex women are. And when I say complex, I would like also to say beautifully complex. It's not like when we hear complex, it's not like in the negative sense of the word, beautifully complex. And my interest was regarding specifically women in certain societies where they are exposed to values and norms that are not always coherent. And my interest was like, how do they do? How do they incorporate these different values that some of them are, let's say, more modern, some traditional, and how do they blend and incorporate these different values to their identity? What do they do with it?
What you're saying makes a lot of sense. And I think if we look at the global body of research, one of the things that we see is over the last 50, 60, 70 years, there has been a huge shift when it comes to women's participation in the labor force. And of course, that is going to trickle into not only women's identity and sense of self and their own well-being and mental health, but also into the family dynamics with a prospective partner, if there is a partner, as well as children. Is that something that you have been seeing and noticing and working on?
Yes, exactly. And what is interesting is to kind of see what is specific to certain societies, because this complexity is different from a society to another. So the evolution did not happen, social-wise, did not happen in the same way. Some category of women or this part of society, modernity, it hit in a certain way. It hit them in a certain way. While in other societies, like in Europe, for example, the Western societies, the progression was more slow. So there was like, let's say, a kind of period of revolution, and then laws, they progressed, and then transformations happened in the social structure, in the society. So the change was kind of smoother because it took a certain time to happen.
It sounds like it was more gradual.
Exactly,
And it was
gradual.
supported by all of the external factors as well, like you said, the social structures.
Exactly. While, for example, in the Arab societies, this did not happen. It's as if we imported the outcome, which changes everything.
Absolutely. Absolutely. Okay. So tell me a little bit about what you see in your clinical work. And I know that you've done loads of research on this as part of your PhD and graduate degrees. But how is it showing up, this tension or these challenges related to the different roles and different identities that women are facing in our societies?
Actually, sometimes we name the manifestation simply as like identity crisis.
Okay.
But it's much more delicate, and it's much more complex than this. So Actually, in the clinical practice, when we are receiving a patient, when we have to, they have symptoms, a certain symptomatology, etc., naturally, we hear more or we are prepared more to think about, like, when it comes to the roots, we think about loss, we think more about trauma, but we do not think enough or we do not talk enough about identity issues. And this is what makes it very interesting. Everything that we do not name enough, we do not normalize enough, the impact on the individual can be like more hidden, and then it can leave more and more impact on the person because we do not name it. And we were speaking last time about how much we are hearing about trauma, and sometimes like in a very simplified way, etc. But we don't speak enough about the transitions.
I think you're absolutely correct. As time has passed, mental health issues have become a little bit less stigmatized. There's more awareness. There's definitely buzzwords like trauma and narcissist and OCD sort of flying around. So when people present to the clinic, maybe they have these things in mind. These are the things that they want to explore. But what you're talking about, to me as a social psychologist, really relates a lot to gender roles and sociocultural context and the expectations that people have on them based on their culture, based on their gender, based on the intersection of that. And these things are not named. And I think that part of the reason maybe they're not named is people are shy. Maybe even some are embarrassed or ashamed to talk about them.
Yes, because it is linked to judgment and being adapted or not. Like when you say, because you were asking about how does it manifest? What do we see in the clinic? So there is a feeling that sometimes women, they have. It's a feeling of discomfort. Just a feeling of discomfort. And it's a very interesting feeling because it's not intense enough to say, I want to do something about it.
Yes.
And it's not light enough to make you feel comfortable where you are. So it's kind of, it pokes you. It tells you there is something. You need to look, like we can compare it to what we call restlessness.
Yes.
It pokes you. There's something that is not sitting well, that is not, I'm not feeling well about something, but I cannot put my finger.
Off.
Exactly. I cannot put my finger on it. So it's not named. We don't know what it is about. So it's banalized. But sometimes this feeling of discomfort tells a lot about what is happening, but we do not speak about it because we are supposed to feel to be adapted. So whenever you point out that there are questions in my mind about the roles, I am questioning. Immediately, there is our super ego, the space in our mind that will tell us, no, you need to. Everyone did it. Everyone managed.
Yes.
So what is happening? You put it on the side, and then this feeling of discomfort will be transformed to something else.
Okay, so what I'm hearing you say is that below the surface, maybe at the surface, there's this sense of something is a little bit off. I don't quite know what it is. I don't quite know how to articulate it. And when I do feel it show up, maybe in the tension between, fulfilling work-related responsibilities and parent/spouse related responsibilities. And I can identify it. There's a part of me, my super ego, that says, no, this is not a big deal. You're overreacting. Everyone before you did it. Just suck it up and move on. And then it kind of gets suppressed, maybe, and then ends up coming out in another way.
And we can say to ourselves, like, just do it. But at the same time, also we can hear it.
Yes.
We can hear it from people around us, especially young mothers.
Yes.
Who are becoming mothers for the first time. And they have people around them to support them. But with the support comes sometimes messages. like I did it. We hear it a lot. Like
Of course.
it was easy. My my baby slept after 40 days. So then the young mother will say, why it's not happening this way with me? And when it comes to this feeling of discomfort that is like kind of brushed off, it can hold or it can hide, as I said before, like issues that are very deep.
Yes.
Because when transitions happen, there is this sense of identity that is shaked. Because in the word identity, if you want to a bit translate, how does it look like, the identity? It's the sense of unity. Unity, continuity, the permanence. When we wake up and we feel that, yes, this is me, or we recognize ourselves in a picture, or, for example, when we speak with a good friend and we say, this friend knows me well. So you recognize yourself.
Yes.
And when you feel this unity, you are happy about it. It gives you like a sense of coherence, permanence, and unity. When transitions happen, these feelings or this sense that you can have, that I know myself, it is shaken.
Yes.
And it takes a hit in different stages of life, but it is not recognized neither by the person that is going through these transitions or by people around them.
Yes. So I think one of the major transitions, you said the word transition multiple times, as well as identity. I think one of the most transformative experiences that someone can have is to become a parent for the first time, certainly. And then also there are transformations and transitions and conflicts that can arise the second time onwards. So tell me a little bit about this transformative aspect of parenthood and how it shows up. You mentioned already this idea that for mothers, since we're focusing mostly on women in this conversation, that they're often surrounded by people, which can be a wonderful support, but support can also feel a little bit isolating when there is this message of it should be this way and or you're not doing it properly.
Yes, it is the main transition that women can go through is the transition towards maternity. And it happens in a more intense way nowadays because more and more, they have different roles. Nowadays, women, they work, most of them. Or at least they are expected to, without
Yes.
it being said. Most of women, they do long studies. So the rational and normal conclusion is that they will work. So without it being like said, this is an obligation, even though it's becoming an obligation somehow, because like as we can witness in the UAE, for example, an expat couple that comes to live here, they need two revenues somehow. So it is an obligation without it being so. And the transition to motherhood, it is much more intense when we have this other part of our identity that we are building at the same time. And of course, when it happens that you are in the middle of your career and at the same time you want to conceive, two intense aspects of yourself developing at the same time,
Yes.
how to juggle. And what is specific to the actual mothers is that actually there is no recipe.
No.
They are putting the first stones. They don't have a reference, actually. They do not.
Definitely. And I think that there is more of a gap between more recent generations and the generation before than there was historically. And I want to comment on something that you were saying a few moments ago, which is that women nowadays are much more likely to be engaged in higher education, which presumably is a pathway not only to acquiring knowledge and skills, but towards having a career. We see that in the UAE, and it ends up having ripple effects, right? Number one, it is delaying the age of marriage, and also it's delaying the age of childbirth and that transition to motherhood. And you described it, right? People are becoming mothers at the same time. That is very critical in their careers. And how do you end up going about and integrating? But I think overall, one of the things that's really tough is that when you said there's this expectation, it's that no matter which way we go, there's always going to be a voice saying you're doing something wrong. So if you end up working outside of the home, there is this assumption that you're not involved in the home to the extent that you should be. If you end up working exclusively inside the home, there's this assumption that you're not contributing to society and to the family in a different way, in the way that you should be, and that it's sort of a waste, if you will. So, pardon my language, but it's almost like damned if you do, damned if you don't.
It's hard to escape the guilt. It's hard. And one of my professors once told me, we have to somehow try to live with the guilt because it will not leave us. But of course, it shouldn't be intense. It will stay somehow. And why? Because we are not perfect. If we have this expectation of being perfect, or we have certain standards, as human beings, we cannot, this is something that we cannot achieve.
No.
I always say to mothers, you cannot be everything for everyone, everywhere, all the time.
No.
You cannot. It is impossible. And we fall a lot into this. Why? Because we want unconsciously, even though we say, I have nothing to prove, but unconsciously, women today, they feel they need to prove something. They need to prove that they can do it.
They can do it all.
They
And
can
be
do
it
it
all.
all. Exactly. While it's not possible.
No.
It is not possible.
And I think also this age of social media, I don't think it helps, because with the curation of content, you see people out there who seemingly are doing it all. And so rationally, you might know that, okay, I physically cannot. And it reminds me of this saying that I saw once that, women are expected to work as if they don't have children and parent children as if they don't work. It's not possible. But when you see it on a social media platform, or you're receiving filtered information from people in your society, in your group, there's always going to be that question of, okay, well, if they can't do it, why can't I? Maybe I'm not trying hard enough. Maybe I need to do more.
Exactly. And this is where they think, some mothers, they think they rush into diagnosing themselves. They come with like suspecting they have, let's say, baby blues, postpartum depression. And there is no harm in this because we are raising awareness, etc. But diagnosing ourselves just because we are sleep deprived. I mean, when I dig a little bit, just, I ask few questions. Sleep deprived. For example, the mother just gave birth. Just gave birth like 2 months ago. So I dig more and I discover the fatigue, the lack of sleep. And then they add it as if it's a small detail. I discovered that they work full time at the same time. So you have enough to feel what you are feeling. Let's not diagnose ourselves and just validate and acknowledge that what you are going through is a lot without a guidebook, without a guideline. And these women, why do they diagnose themselves? Because they think that I'm not doing it right. Others, they are handling it. And yes, social media is playing a big part in this. not only in showing beautiful pictures of mothers with their children and everything is you know beautiful. No, it's also by giving a lot of recipes to mothers. You should do this, you shouldn't do that. Positive psychology. And I'm not against, of course, but I'm against the intensity. We are flooded by information. And there's a small nuance between awareness and overwhelming mothers with these lists of you should say this, you shouldn't say that, you shouldn't say no to a child.
Oh, yes.
So the superego that we were talking about becomes harder and harder. And what is specific to women today is that they are hard on themselves. Why? Because they tell themselves, I know, I'm educated.
I should know better.
I should know better. I shouldn't do the same mistakes as my parents. And I can hear it also in my patients' speech sometimes, like when they want to describe their parents' way of educating, they say, this is what they knew, right? That much they knew. So if we know better and we have diplomas, how can I act this way?
Without considering that our children one day might say the same about us. Like, this is what they knew they were doing. Because what it means, this is what they knew ultimately, is they were doing the best that they could with the resources that they had available to them. We might have more and different resources, but also what you're saying, and I agree with totally, is that there is this inundation. And even if we have now, we always say parenting doesn't come with a manual. Well, people are trying to make manuals. And even if there is a manual, manuals are not broadly applicable. What might work, anyone that has more than one child knows this. What works for one doesn't work for the other.
Of course.
There are so many layers and contributing factors. And if there's this expectation that we need to have it all figured out, and we're missing that reference point, like you said, there isn't for as many women of our generation the ability to connect with our mothers the way that our daughters might be able to connect with us. What do you do? What do you do with that?
And also, like there is this, when we have all these recipes and we have all these lists and recommendations, then we can, if we do not follow, we will feel that we are not in control.
Yes.
This is something very specific also to women today, working women. I always try to tell them that with your baby and in motherhood, the sense of control will be challenged. So let's say there's a working mother. How many days she has? She can afford to stop before delivering. Let's say, I don't know, 1 month, and then the baby is there. So 1 month back, she was on her desk with the guidelines, with the calendar, with the goals, objectives. You do what you need to do. You have a guideline and a target. You do the target. You are happy about yourself if it goes well, and you are satisfied. So control, and it worked. Then the baby comes. Unconsciously, you think it will be the same. And you try to apply. And the baby will come and disturb all this way of reasoning.
Yes.
And this is where many mothers, they start to experience anxiety for the first time. And anxiety, by definition, it comes to mimic in the body this feeling of loss of control. So it does not work in the same way, and there is no time to adjust.
Yeah.
A month before giving birth, to just process what's happening, the changes, etc., and prepare the mother to what she needs to expect. Then the clash will happen. I'm not handling it well. Well, It's not about handling. It is an emotional process.
Yes, absolutely. And, you know, you're describing someone who is very organized and very meticulous and thinks that if I cross my T's and dot my I's, everything is going to go according to plan. And as you were sharing that, a statistic came to my mind, and that is, I think only 5% or less than 5% of babies are born on their actual due date. So even from the day that the baby is born, things are often not the way that we anticipate. They either come early or they come late, and it derails our plans. Not to mention the birth plans often don't go according to how we anticipate. And then everything happens so fast. And you find yourself, I think, in a place of reacting rather than responding because you're being hit by so many different emotional experiences, physical experiences, social experiences, and so on. It's very disorienting.
Exactly. And we need to follow. This is what we. I mean, if there is something that we are prepared for, is that we need to follow the rhythm of the baby. The baby will decide when he wants to sometimes sleep. We try to regulate. We try, but it's not like there will be, especially in the first few months. There is no necessarily very specific order for things.
And when you find your rhythm, it's gone often because that's what happens in the early phases, right? You think, okay, now we know that the naps are generally happening around this time. And as soon as you settle into it and you find yourself restructuring your day, boom, they're gone and you have to be on your feet. And, you know, I think that there's a space for people to share and connect with others about the struggles and the challenges that they're having. But there still is this hesitation of, I don't want to say too much or share too much about my struggles because it looks like it's coming so much more easily and more naturally to everyone than it is to me. And I don't want to be exposed.
Yes. There's the shame, the guilt, and there are so many also like there's symbolism around the mother figure. She knows. You know, all these sentences we hear that are interesting. Like when mothers say, we can hear them saying, this cry, I know what it is. And this cry, I know it. Really? Or it's just like to be comforted with this sense that I've got this.
Yes.
I can translate.
And you need that in some ways. It serves a purpose when you've got all of these different things going on and it's a new experience. And like we were saying before, even the second baby onwards, it is still a new experience because they bring their own challenges and strengths and dynamics and habits and routines, right?
Yes, but we do not say enough to mothers that it is a learning process. So I was mentioning the symbolism and the fantasies around the mother figure. She knows, and she will figure it out. And also there's a very important idea around motherhood is that it is very linked to nature.
Yes.
So it's a natural process. And then that we discovered that it is a step-by-step learning process, but no one says it. No one. It's as if it's a secret in the drawer.
Yes.
Why not to say it? There is room for mistake. There is room for learning, and this is what women, they need to have a certain solidarity, and like there should be a community of women. Now we are seeing a little bit of this.
Yes.
But when there is the shame and the guilt, it will separate.
And it's much more complicated now. If we think back, you know, it's mother nature, mother's instincts, all of these references. Before it was simple in a way. It's like, keep the baby alive. And now it's like, okay, we need to keep the baby alive. We also need to make sure we've got all of the gear. We also need to make sure that we're setting them on the right pathway for optimal development, psychologically, emotionally, behaviorally, socially, academically. And there's a lot, and sometimes even the guidance changes. So the amount of things we have to consider, in some ways, it's not really very natural anymore.
And it's a bit too ambitious.
Yes.
I mean, all what you have mentioned, plus, which is something we can be, of course, proud of, they want to break transgenerational trauma,
Yes.
which is by itself a huge field. All this, which of course it's amazing because it will create the change for future generations. That's for sure. But sometimes it's a lot.
It's a lot on one person, especially if they feel like they're in isolation. So tell us a little bit, for those who are not familiar with the term, what is generational trauma and how is it showing up in this space? Women wanting to break it.
They want to have their own, first, they want to work on what they carry from their own childhood, etc. And they don't want to necessarily transmit. But what is interesting about this process, and this is where I catch that there is a super ego that is a bit tough, that is a bit hard. We set, and of course now I'm going a bit in the opposite direction, because we encourage women, of course, and parents to do some work before they decide to conceive. And we always say that the process of conceiving starts before the woman gets pregnant.
Absolutely.
So we encourage this process. But for it, there is this nuance. For it to become a target and a duty, this is another level. So here where we say, one by one, let a little bit the process to be natural. It will come phase by phase, and you will do it not alone. You will do it with the help of your partner, because you do not conceive alone. There's the father, and you will do it with the help of the child. He has his word to say. He will be active in the process. So you are not alone, because women today, it's not that they want to perceive themselves, but they can slip into this. You have all the powers. You are alone in this process, and you need to make it happen alone.
And I think it goes back to what you were saying before about the transformation. This whole idea, correct me if I'm wrong, of modernity is that I should do it alone because I can do it alone and I don't need anyone. And it's one thing to be able to do things independently and individually, but as humans, that's not the way that it's supposed to be. And there's no weakness in leaning into our dynamics, our relationships, our community. That's what they're there for. They ensured our survival.
Yes. But this is also, sometimes there's a trap that we can fall into, because mothers in the previous generations, they used to kind of do it, or they are told that they can do it alone. The fathers, they used to work. Mothers, they used to be, I mean, of course, I'm speaking about the traditional way, the most common. Mothers, they take care mainly of education. If they work like teaching, part-time, etc. But mainly, they need to multitask, and they need to take care of everything that is related to children. So we took this, maybe unconsciously, we inherited this model, plus the duties of work, and that's why we can slip, because we have all these models. We have interiorized how our mothers used to do.
Absolutely. And I think, what you're talking about is this idea of gender stereotypes. And if I think about the parenting literature, the fathering literature in specific, at the time when there was that very traditional division of women are working inside the home, men are working outside of the home. men were not even included in research because the idea was, why would we bother talking to you? You don't know anything. You don't have time. You're not involved. You are a paycheck. She is everything. And now we see that neither of those things are true. But like you said, unconsciously, there are these expectations. And I don't know about you, but what I'm seeing with clients, as well as even in my own circles and networks, is that when someone violates that gender role expectation, people really struggle with that, sometimes positively and sometimes negatively. So a father who is very involved, who goes to the birthday parties and the pickups and will leave work early because there's like something to do with the child that they want to, is revered. Like, you're against the stereotype, but you're an amazing, amazing, amazing father. Women, on the other hand, when they violate the gender norm of, I can't make it to this play or this event, or I won't be able to come to the pickup or the birthday party because I have something really urgent at work. It's like all of a sudden, ice queen, you know what I mean? Not maternal, not nurturing, and not caring. So even though we've come a long way, and the way that families are distributing things is different, when someone violates those old school norms, it doesn't go very well for women, especially. Have you noticed the same?
Definitely, but there is also, we speak, of course, about the intensity of these transitions in women.
Yes.
But we, as you are saying, we speak less about fathers, because also we fall into this trap of they are not that involved.
Yes.
But as you are saying, a man that is challenging the stereotypes, it's as if it has something to do with how we divide masculinity and femininity. Is he masculine enough? If he changes the diapers, if he cooks. And it is challenging for the father himself, because also he is creating he's starting from scratch somehow.
Yes.
Because he does not have also a reference.
No.
His dad didn't used to do it.
Very
so
true.
he needs to be confident enough to say, I am starting the change.
Yeah, no, you're absolutely right. There is no reference, just like for women of this generation, and probably even more so, because we're seeing now that fathers are much more involved in so many things. And I agree with you, and we've seen this in clinic as well. Men are affected by the transition, and also if they see that their partner is struggling with identity and also prioritizing the baby, which needs to be done at the beginning of the child's life, particularly, there is his own internal struggle. And I think that kind of compounds how difficult navigating those early days of parenthood are for everyone.
I think you in your clinical practice with couples, you must maybe you have noticed the time how it is different between man and woman when it comes to this transition to parenthood.
Yes.
We were speaking that both of them, they go into the struggle of the transition when it comes to their identity, but it's as if, and not to fall into comparison, like women, it's more intense,
Yes.
men, it's less intense, but there is a reality. Women, they do not have, mothers, they do not have the time. A baby needs to be fed. There are his
On demand.
his needs, exactly. And we speak about skin to skin. That is now, of course, very recommended, etc. The father has more distance. Nothing is happening in his own body, even if sometimes they fall into mimicking unconsciously. True. But they are more distance. And when you have the distance, you have also the time. When you have distance and time, the transition can hit you a bit more softly. While for women, they do not have. It needs to happen on the spot.
And I think that one of the things I see in my work with couples, especially with young, very young families, is there's this question of who am I, right? Your
Yes.
whole world gets rocked when you become a parent. And then for the partner, it's also who are they? Who is this person? And so I would imagine for the women that are already navigating and trying to integrate these two things that are not particularly compatible without the frame of reference, as you said, and then also hearing from the partner, like, who are you? Where are we? What's going on with us? Coming from a place that makes a lot of sense,
Yes.
missing the partner in the old dynamic and wanting to try to reclaim or address that. It's a lot.
Yes. And this is maybe something that in couples therapy, while maybe preparing to parenthood or during the first phases, it's very important to speak about what's happening. And of course, for the therapist, I mean, the work you do, I think it's to translate.
Yes.
To translate, and at the end to make them realize that they are a team in this. It's not that the father is outside, because this is what sometimes fathers they feel. They are out of this bubble.
Yes.
They are excluded, and there's the mother and the baby. While they are a team, and if we reestablish this communication between them, maybe the mother can be able to explain and describe what she can be going through, so she does not fall into this pressure of I need to get back on track as fast as possible. If not, my marriage is in danger.
Yes.
You imagine the pressure, and this is where we don't give ourselves the time. First, the time we cannot afford it always, because sometimes 2 months after the birth of the baby, women they need to go back to work, which is somehow aggressive when it comes to the psychological time and the separation. So there is no necessarily the time needed to process and adjust. And when there is this pressure of going back to my couple's life, if not, it can be in danger, then I have to go back to my body, femininity. I have to erase the scars of
As if it never
giving
happened.
birth. Exactly. This is something that we see a lot, rushing into gaining back our look of before getting pregnant, while something huge happened in between. So there is no harm, of course, in wanting to be in shape again, but just we can just have the take a bit of time and blend the changes. So your body will not be the same, but it will be a bit different, and you are still the same. When you were saying, like, there's this question, who am I? This is what they come with. Who am I? I'm not feeling myself anymore.
No, I don't recognize myself in the mirror.
Yes.
Physically, as well as psychologically and socially, and all of these things. So I'm hearing from you, a big part of it is acknowledging the incompatibilities of these expectations and the high standards, being a little bit more gentle with ourselves,
Yes.
trying to engage people in our network, hopefully being a little bit more real about the struggles that we're experiencing so that we don't feel quite so alone. And I think another thing is what I just said in some ways puts a bit of the burden on the person who is struggling. For all of us who know someone who has just become a mother for the first or 15th time, we can also help by checking in.
Yes.
And by offering to do concrete things. Not let me know if you need anything, because people will always say no, but volunteering to do something that is going to take a load off. And little things make a huge difference, especially in the early days. But tell me, when someone presents to you with this identity conflict and tension, how do you work through it in therapy?
So just by, you might think it's very, very simple, but just by sitting
Mm-hmm.
in the session. And there's these 45 minutes or 50 minutes that will happen. There's just pausing actually and just speaking about. So first, when you sit, okay, it's me, quiet, me and my thoughts, and there is someone who is listening, and just by validating the simple things, sometimes it's a breakthrough. It's a breakthrough. It's enlightening, and then a whole work can start just by validating, because they might come, as I said, I'm suspecting a postpartum depression. So let's put this on the side. Let's put this on the side. What is happening? Just by sitting and talking little by little, when we feel comfortable, about the past, about the present, and automatically about the future, just this exercise that can take shape differently every session will make you feel that I am centered. I feel my unity, and the past is linked to the present and to the future, and this work of the blending will happen.
Yes. I think what you're describing in large part is just slowing down.
Definitely.
Right? Because with all of the obligations we have, no matter who we are or what we do or what roles we occupy, I always describe it as I'm just putting out the most urgent fire in front of me. You're just rushing to work through as quickly as you can whatever emergency has presented itself to you. And that can be very difficult and disorienting. So coming into a session and centering yourself is huge.
Yes, it is.
Forming a relationship and an alliance with someone who hears you and sees you and kind of helps you blend, as you said, is huge. And I also notice, I don't know if it's the same for you, but sometimes people that come to therapy, mothers are expected to give and nurture and do all of that. So they're the givers, they're not the takers. And therapy is like the first time in their lives often that they're the takers, but they feel okay with it because they know at the end they're going to pay for that time, right? They feel like I can talk to you because I'm paying you for your time. There's an exchange here. Yes. It's not me just opening up and talking about myself and what's going on with me. So it's very new, a very, very different experience for so many of these women.
Yes, and sometimes just from the first session, like they feel that there is something. I mean, for us therapists, it doesn't feel that we did something huge, but for because we are, used to have this exercise, and this is who we are. So, but for them, it's like a huge shift.
Yeah, it is. It's powerful. So you said about blending. Tell me a little bit about blending. How does that work?
Yes, so it is like we spoke about the changes, the transitions. So this is me. It's as if, imagine you have a base, and then an event happens. If I brush it out, I do not process it enough, and I continue, then it will pop up for it to be processed later. Let's say, for example, when the children, they for example, they grow and they leave home. Sometimes we don't give ourselves the time to process it. We dive into the practical aspects, etc., and we continue. Then it will pop. Why we don't want to tackle the subject? Because maybe it is linked to us aging, let's say. But if we think about it, that a change happened, and it will not be the same, which takes us to what we can call and describe. I read an article about it, the ambiguous grief.
Yes.
The one that is not recognized as the grief like losing someone physically. We are faced continuously with ambiguous grief, and because it's not named, we don't know what to do about it. So if we grieve, things will not be the same, but they will be different. And I will keep something from the past, very precious. and I will be open to what the future will bring, and I will blend them, and it will make me. I always tell my patients, identity work, I mean, for me, it's beautiful, but it's not easy to be done, but it is a continuous work because we are always exposed to changes.
Absolutely. We have changes and we shift and we grow and we develop. And like we were saying about a baby, as soon as we have our rhythm, something usually pops up.
Yes.
The same with us. And that's part of the beauty of being human, although it can be definitely challenging to integrate things that on the surface look like they're in opposition. But you're saying that there are ways to take and combine in a way that leaves us feeling coherent,
Yes.
settled in the present, hopeful about the future.
Yes, and if it is different from previous generation, it does not mean it is less good. It
Yes.
is just different. It's a new way of being, and I think that all women somehow they are pioneers.
Yes.
They are setting the first stone. They are becoming the reference for the new generations, and this by itself is huge.
I agree with you. And I know we didn't speak so much about men today because our focus was on women, but I think something probably we can agree on is they're also being pioneers in their own way.
Exactly.
Because they don't have the reference for being more involved fathers, but they also don't have the reference for having partners who maybe have different roles and different expectations and different requirements from them. So it's a big shift societally, particularly in some places like our environment. And it's something that we're navigating, I guess, as best as we can.
Exactly.
Yeah. Perfect. Thank you, Diana, so much for your insights and for your time. As I mentioned at the beginning of this episode, you've been with us at Thrive since January 2022, and you work with adults using psychodynamic psychotherapy. You have, of course, a very special interest in women's issues and mental health and identity, but you also work with men.
Exactly.
So if anyone would like to reach out and see you at the clinic, they can find you via Thrive. Thank you so much again for your time.
Thank you so much for having me. Thank you.